Welcome back to Studio 701. While many of us struggle with the hardships of COVID-19, health professionals are really on the front lines, and it might be taking a toll.
In this segment, Coping with COVID, we hope to bring some light to what's been a dark time for many people.
Dr. Melissa Hankey joins us now. Thank you so much for being here.
Yeah, thanks for having me.
You're the medical director with NDPHP, which is the North Dakota Professional Health Program.
Correct.
So, Dr. Hankey, just tell us, first of all, what the program is all about.
So the North Dakota Professional Health Program was created by legislation in 2014 as an alternative to discipline for physicians who struggled with the diseases of mental illness or substance use disorders. Prior to that, if a provider was struggling with substance use disorders or mental illness, there really wasn't a place for them to go and get the support that they needed. So unfortunately, many times their disease progressed to the point where it affected patient care, and then the Board of Medicine would get involved. But that really is career-changing, life-changing. So it was created as a program to support providers. Currently, 2/3 of our participants are voluntarily enrolled, meaning they reach out to us, they seek our help to get them back on track before they endanger anyone, including themselves. So most of our participants deal with substance use disorders. Primarily, that's what we deal with.
Throwing COVID-19 into the mix, how has that impacted health professionals here in North Dakota?
Right. Well, COVID has been hard for all of us. I mean, I think about as a mom, there have been unique struggles as a wife, but certainly as a medical provider, there's a whole nother set of struggles. I think people look to me all the time and say, well, what do you think about this? I don't have any more information than anyone else. And I think that a lot of burden has been placed on healthcare providers. When we went to medical school, nobody ever told us we were going to be providers in the middle of a pandemic.
Right.
And so it really has been a game changer. And I think for a lot of us, it's been a struggle. Isolation is not good for any of us. We get cut off from our support that we need. And especially people who are in recovery, they need their meetings. They need their sponsor. They need to get out of their own head and their own environment. And so it has been a unique challenge.
Probably now more than ever, this is a really important program for this kind of support. So who can actually make a referral for someone to NDPHP?
Actually, anyone can. So it's really meant to be there for if you are concerned about a provider having a mental illness or a substance use disorder. Interestingly, ethically, providers are mandated to report a colleague who they think is struggling with a substance use disorder or mental illness. We certainly want referrals to come in before it affects patient care. I mean, we would love for providers to reach out to us themselves, and that is actually what we are dealing with mostly now. Again, 2/3 of our participants have sought our services without having to affect patient care, and that's what we want. We don't want there to be issues in the operating room, the emergency rooms, the clinics. We want people to come to us when they are concerned, but before it really is impacting their patient care.
Absolutely. Well, it's so good to know there are programs like yours out there to help people. This has been Coping with COVID, and if you do have more questions or you'd like more information, we'd like you to check out ndphp.org. Thank you so much, Dr. Hankey, for being here.
Thank you for having me.
All right, we'll keep it here. Still